Anybody that ever had cancer? Have you ever gone through that? Maybe yourself or a spouse or someone that you love? Over 70% of all cancers happen to people when they're over the age of 55. That's when cancer starts to strike. And yet, many seniors don't even know that they could have a particular policy that will pay them in cash if they get the diagnosis of cancer. And that opens up a world of treatment options that you may not have otherwise had. Hi, I'm Christopher Westfall, and I'm an insurance agent. I work in all the states of the United States, helping people with insurance, primarily focused on the retiree class of folks. And I don't charge anything for my service, but I want to share with you today a story from a lady that we helped. And she bought a policy that would pay for any cancer treatment, anything she wanted to do when she got a diagnosis of cancer. And we were able to get her a check for $10,000 after she'd had that policy for less than a year. She was just turning 65. She was 65, so her premium was $25 a month for a $10,000 cash benefit. She was diagnosed with cancer in that first year on Medicare. Now, her Medicare and Medicare supplement paid for all the treatment. That's not the problem. The problem is she had to take off from work. See, she was still working and had to have somebody come and take her to appointments, sit with her during chemo, help her around the house, pay for other things like drugs. The drug costs when you're on cancer, either to not reject the chemo that's happening or the chemo itself can be orally delivered. That can be quite a burden, up to thousands of dollars per month that most people, even on a Medicare supplement, which is great insurance, don't recognize. That's a huge potential cost. So I want you to hear in her own words, her experience with this process of going through our agency and listening to our recommendation in her particular case. And then at the end, I'm going to go through some of the statistics that may affect you and why you might want to consider this coverage. Stay tuned.
Okay. It started off because, I got Medicare, and I'm diabetic, so I figured if I was going to have any problems, it would be from my diabetes, not. I never in a million years thought about cancer. She mentioned cancer policy, and I said, I probably won't need it. I said, how much is it? And she told me, I said, go ahead, because you never know. And my mom died of cancer. So I signed up in April. I started having some bleeding, and I don't know if I should be going into details in October. Finally, I had to go to the hospital in November because I was hemorrhaging, and I was in so much pain. The pain was unbearable. So I went, and what happened? Oh, they diagnosed me because they ran a bunch of tests. And so I didn't know what to do. So I happened to go with my cousin she had to go see an oncologist. And I went with her, and he said, I can't, do anything until you're my patient. And so I went to Methodist Hospital, and he worked for Methodist, so he was able to pull up my stuff whenever I was his patient. So I went on my cousin on Monday. I had an appointment with him on Wednesday, and he showed me the test, and he told me that wasn't supposed to be there, that it's more than likely cancer. This doctor is the best doctor I have ever been to in my life. So he spent about 45 minutes with me. He got on the phone and made a phone call. They called him back. The surgeon's office called me the next day. That's how good he was. So in December, I had a biopsy done. Or I had to go back to the emergency room because I was in so much pain. They were giving me morphine and Dilaudid, and it did nothing for the pain at all. It was the most painful experience I had ever been through in my life. Childbirth was nothing. And so I went back to the emergency room. They were giving me morphine. They gave me Dilaudid, and it did nothing. My blood pressure was like 207 over 100 and something. Anyway, so I had surgery on a biopsy done on January 10th, and I had surgery on January 18th. And it was the difference between night and day. I had to use a walker. I had to stay with somebody for a week because I wasn't up, moving around very well. I was sore, but I wasn't in pain. I didn't even have to take pain medicine after the surgery. And I called the cancer policy and told them what was going on. They told me to have the oncologist send them some information, all the legal stuff they needed. And I waited 2 or 3 weeks to call them, and they said I was approved. They sent me a check for $10,000. And that's all that happened. I've already cashed the check, everything.
That's amazing.
And they canceled it, of course, because it's a one-time payment. And then they canceled it in January, went ahead and paid me, and they sent me a check where they had charged me $61 and, sent me a check for, what month? February and March. Wasn't that good of them? Aetna's great. I mean, they did me well.
Yeah, so they even paid you back for the premiums that you had paid up till that point?
Yeah, they paid me back because see, once I called them, they canceled the policy, but they still paid out,
Yeah.
And they had charged me for February and March. That's the only thing I can think of, and that's what they said, basically. And they sent me a $61 check.
That is so great.
So I got $10,061.
That
and
is,
if it wouldn't have been for the lady that, signed me up for Medicare, I would, the supplement, I wouldn't have done it. But let me tell you something. The supplement plan, she said, maybe I haven't paid to see a doctor one time. And I have been to the doctor more since November, I think, than I have in my whole life. Because I have to go see the doctor right before I have chemo. Anyway, so the cancer policy was great, and I would recommend, it's worth the $25. It's more than worth. I don't know what else to say about it. It was just worth it.
And what made you decide to enroll in it back when you enrolled in everything else with Melanie?
Well, I wasn't going to. Because, like I said, I figured it'd be my diabetes that got to me, which my diabetes was doing good, But, and then I got to thinking, well, you never know. My mom died of cancer. She died of colon cancer, so she waited too long. And I said, I guess I should get maybe. And I asked her how much it was, and she said $25.50. And I said, well, I can afford that. And she told me with the amount of times I go to the doctor before all this happened that I should get Plan in. I'm telling you, Melanie was great. She didn't try to push it or anything. She said, well, sometimes you have to take pills in place of chemo. Well, now I can use that money to pay off medical bills. Without it, I wouldn't have been able to. That's another reason I would recommend people. The cancer policy, is that with that, I'll be able to help pay off bills. So I would recommend it to anybody. I would recommend y'all to anybody. God has blessed me, I'm telling you, because things just, things fell into place. I seen that doctor, and he really cares about his patients. He got me into a surgeon within a month. I had my 2 surgeries, and I owe that, and then I owe that to Melanie because I don't pay anything to see the doctors, even with Plan in. I'm surprised. I thought I was going to have a copay. I haven't paid a dime out for seeing a doctor. And I don't think that the doctor I see is fantastic. Melanie did good. I didn't know I could get a cancer policy.
Well, I'm glad that you ended up deciding that it was worth the shot of spending the money on it for the just-in-case scenario, because like you said, you never know what's going to end up happening in your life.
And see, with my age, I just turned 66, okay? And my mom was older when she got her cancer. And that was another reason why I got it. Who would have thought at my age, at 65, who would have thought at my age? Do you think of people getting female cancer? See, I had female cancer. I had to have a complete hysterectomy.
Mhm.
And who would have thought at my age?
Exactly. You just never know. Which, by the way, I was going to tell you happy birthday. Your birthday was yesterday, right?
Yes, and I had chemo yesterday.
Oh, no, that's not how you want to celebrate your birthday.
It was fun. I celebrated on Monday. I made out like a bandit with gifts and stuff. It's okay, you know. I'm alive and everything. I got that money. Because I'm going to be real honest. If I would not have gotten that cancer policy and I get a bunch of bills in, I would not be able to pay them. I'm just grateful that I got the cancer policy because it's going to help me tremendously. Well, I owe it up to Christopher. You know how I got his name?
How did you get his name?
YouTube. I started watching people on YouTube, and I looked up one, and it was, the reviews just were, it's like, I can't go with these people. I can't go with these people. So I pulled up Christopher's, all 5. That's all I've seen on people, you know, because you can review people, and all they gave him was 5, nothing less. And that told me right then that he cares about his people. And so I said, that's the man I want to go to, and that's why I called y'all, was the reviews that people were giving. I gave them 5 because I was very, very happy with, you know, everything that took place. I gave y'all 5. And that speaks long on, if people on reviews are giving y'all 5, what does that say?
Exactly. And he, like you said, he definitely cares about his clients, and he runs a company that we all feel the exact same way that he does. Like, our expectations are just as high with how his views are. So we have that mindset where if we wouldn't feel comfortable doing selling something that we wouldn't want to sell to our parents, then we're not going to sell it. So that's why we like to have that family mindset no matter how big our company gets. So.
Well, you know, it's just that Melanie took a lot of time with me and explained it. And if I had any questions or anything, and y'all can talk about that too, when y'all, you know, write down whatever y'all write down, that y'all took y'all's time while I would fully understand, make my choices, and she helped me with, you know, between Plan N and Plan G. And, I mean, you could tell that she really cared, you know. And the cancer policy, I am so grateful she told me, and I told her no at first, and then I got to thinking about my mom. I said, sign me up. You know, so I just think y'all are great, and I guarantee you one thing, I would tell anybody and everybody about y'all.
Oh, thank you so much. We definitely appreciate that, and I immensely appreciate that you took the time to tell us your story and how everything went, and hopefully it just continues getting better for you down the road with treatments and anything else that's going on with your life.
Because, let me tell you this. I called about the cancer policy. They said, all you have to do is they told me exactly what I had to do, and I went and took the information to the oncologist, and they sent it on. And I called 3 weeks later, and they said I had been approved. As you know, I didn't even have it a year.
Yeah.
And they paid out. I spent about $100 on myself, but the rest of it I'm leaving for, you know, just in case I need it for bills, or you never know. Because one of the medicines, when I got out of the hospital, was, you know, I had to take a blood thinner. You know how much I had to pay, even with Medicare and the supplement? No, the Plan D, Plan D.
How much?
You still had to pay $200.
Yep, that's one of the main reasons why we recommend the cancer policies, because the medications can be so expensive even on the prescription drug plans.
Yeah, it was outrageous because, you know, I think the medicine was sky high and it put me in a different tier.
Okay.
That's why. Because my other medicines that I take, I don't pay nothing for.
That's good.
So anyway, that's what I have about the cancer policy, is that everybody and anybody should get it because they don't know. I mean, I had mine April, May, June, July, August, September, October, November, 8 months. And the cancer was bad. It's category 4, but I had no symptoms. None until November. I mean, none. I would have never known I had cancer if I didn't start having symptoms.
There's some very important things that you may or may not know about cancer. I don't know if you've already been affected by this, but literally 1 out of every 4 deaths in the country is cancer. 1 out of every 2 men are going to get some type of cancer. I know my father, grandfather on both sides, both had prostate cancer. 1 died of it. 1 out of 3 women are going to get cancer of some type. And 77% of all cancers are diagnosed after the age of 55. This is a senior phenomenon, really. And that's why our clients that are on Medicare, we want to let them know that this is something that they could remedy, at least by having options. And sometimes money just gives you options. Look at this. If you have a homeowner's policy, you have a 0.04% chance of your home burning down or being blown away. Auto policy, a little bit higher, but look at cancer. 40% likelihood of filing a claim. That's crazy. That is a near and present danger. It's very clear that this is something we should probably consider doing something about. And then on Part D, people are spending a fortune on the drugs that are needed for cancer. Now, that's whether you have a Medicare supplement, doesn't matter. The supplement won't pay for your chemo that you go down and get at the pharmacy. Same thing with a Medicare Advantage plan. It doesn't even go towards your max out of pocket on your Medicare Advantage plan when you're taking these drugs for cancer, and that's the biggest cost. Here's just a little bit of the drugs. And if you look at the above catastrophic threshold in the red, you'll see how much you'll end up having to pay for these drugs right now with cancer. And that's why we're proposing this as a solution, because I've seen it work. Medicare Advantage is a maximum out of pocket as of the day I'm making this video, $7,550. That's just for the treatment, but it resets every January 1st. So if you're going to have treatment, if you're going to go to different places for treatment for cancer, you better hope that the best places out there for cancer treatment are in the network of your Medicare Advantage plan. If they're not, the only thing that prevents you from going is money. If you have the money, you can go. It's no problem. So again, it just gives you options where you can go. And cancer is a larger concern than heart attack and stroke coverage with Medicare Advantage plans due to how inpatient versus outpatient expenses are charged. And I don't know if you knew this, right there it says, with nearly all Medicare Advantage plans, the client is responsible for what? Client is responsible for 20% of the cost of radiation or chemotherapy. Unfortunately, that information is not clearly listed on the summary of benefits. And that's why I've said for years, if you're on a Medicare Advantage plan, look at the summary of benefits, then go deep and find out what chemotherapy costs you're going to have to pay. You're going to hit that maximum out of pocket. And again, prescription costs are not part of the Medicare Advantage maximum out of pocket. And the other part is, even if you do have the option of going to the really good cancer treatment centers, you have to pay for your own transportation. You have to pay for your own lodging. What does that look like? Well, the cancer plan that we like the best, I can't tell you exactly what the premium is going to be for your age in this video because it may change, may date the video. It may be different in your state with a different product, but the benefit amounts usually go from $5,000, and this is a lump sum thing, up to $75,000. And this is a lump sum, which is different, I might add, than a policy like my mom had. My mom had a policy with Aflac, and it was, as you go, you have to pay a claim. You have to file a claim and then get reimbursed for it. Every visit, every claim, every visit, every claim. And what they know is most people, like they do with rebates, they just don't send in the rebate. They'll give you a rebate of 50% off if you mail in this coupon and get the receipt and put it in the mail and find a stamp. People just don't do that. So consequently, on those types of cancer plans, people just don't cash it in. But on this, it's real easy. Were you diagnosed? Yes. If you were diagnosed, here's your check. It's just that simple. And with this particular plan, they can insure a husband and wife on the same plan. And whichever one of you is younger, that's what they go by on how much the premium is. That's pretty cool. This particular plan is available in 45 states. We do have some solutions for the other states, but the one that we like is available in 45 states. I'll tell you one interesting caveat about this. In California, did you know it's illegal to have a cancer plan if you're over 65, as far as us being able to sell it to you and enroll you in a plan? If you enroll at age 64, it's no problem. But they've outlawed by regulation you being able to purchase one from 65 and above. So if you get it at 64, you're great. If you move to Wyoming and buy it at 67 and then move back to California, you're fine. But in California, as they do some things kind of strange there, you can't get a cancer plan once you're over 65. And most of the people that we help these days, it seems like they're 64, they're looking at their options, they're wondering what they should do with their Medicare insurance going forward. And this is the time that they're leaving an employer plan most often. And so if you're making those decisions at 64, you lock in the lowest rates for a whole bunch of different things: life insurance, cancer plan, your Medicare supplement, lock it in at 65 so that you can get that best rate, especially if you're doing a Medicare supplement 6 months before you're 65, you lock in that low rate. Just to remind you, there is no maximum out-of-pocket cost on prescription drugs. Not yet. It will be in a couple of years. Part D enrollees will pay 5% of the cost yet. Nearly half the patients who face a price of $2,000 or more for a cancer drug say that they just won't get that drug filled. That's a sad reality. But if I gave you a check for $10,000 and said, hey, this drug will save your life, would you take the drug? Still, it's a choice to be made, but I'd rather you have the choice with $10,000 or $20,000 or $25,000 or $50,000 in your pocket. And Medicare supplement does do a great job of covering all the direct medical costs, but it's the prescription cost and the travel and the transportation that's not covered by the Medicare supplement. They say that 39% are the direct cost, and that's where the Medicare supplement is the best. But 61% are indirect costs, and that's the thing we mentioned there. Imagine if you had to go from a 700-mile trip from New Orleans to MD Anderson, one of the best cancer treatment centers in America. You're going to pay for the airfare, you're going to pay for a car rental, and then you're going to pay where you're going to stay. And if you're going to do that over weeks of time and then go back for another course of treatment, how much would that cost? Well, here's an explanation. For 8 weeks, that could be $6,200 for your treatment. But you can get the best treatment you want at MD Anderson if you have a Medicare supplement. But this is just the cost of the transportation and getting there. If you can't see that, let me make it bigger. That's pretty significant. The cost for 8 weeks is $9,160 for an individual traveling alone, or $11,000 for two people traveling together. And that's from WebMD that actually looked at it, going in and getting treatment. What does it actually cost? It's not just the treatment that's the concern, even if you have the best insurance there is. The concern is, what can you solve by having the money available upon diagnosis? You're not sitting around waiting on seeing if you can get treatment. Now, here are some of the best cancer treatment centers in America. And if you live next to one and it's in your health plan, or if you have a Medicare supplement, doesn't matter because you can go anyway. This is where you want to go. But what are your options? What's next to you? And what's it going to cost with your out-of-pocket costs? So cancer is the second most common cause of death out there. And 1 out of every 2 men, 1 out of every 3 women are going to get it. We all probably by now, we all know somebody who's been affected by cancer. And so all I'm asking is that you review this as a possibility when you're setting up your Medicare. We can help you in your office, from our office, to do it. That you're going to ask, what are the questions? What are the concerns? Well, have you had cancer in the last 5 years? If you have not, it's more than likely that you can qualify for one of these plans. And the premiums are not that much. I would just encourage you to review this as an option. That's why I wanted to bring it to you when one of our clients said, hey, I want to tell people my story. She's not the only one, thank goodness, that's actually benefited from these policies. And I believe over the next coming years, we're going to have a lot more people that will come forward and say, hey, let me share this with somebody else who it actually might benefit them, so they don't go through the drama of not having the money to pay for something that would have made a significant impact on the quality of life, or actually your life at all. I'm Chris Westfall. Thanks so much for watching. God bless you. Have a great day.